Hello, welcome to Capital Region Watch. My name is Jack Etkin. It is Wednesday, April the 9th, 2025. My guests in this segment are Correne Antrobus and Leslie McBain. We're going to be talking about the group Mums Stop the Harm, and we're going to be talking about, I guess, the ongoing drug crisis. So, Correne and Leslie, can you maybe start by just telling us how you got into this?
My only child, my son Jordan, died from a prescription drug overdose, actually, in 2014. He was 25 years old. He had his whole life ahead of him. And that is why I do this, the work that I do. About a year after his death, I met with two other women who had also lost their sons to drug harms. And we created and co-founded the organization Mums Stop the Harm, which is has several purposes, but one is to advocate for better drug policies that support people who use drugs, and also to support families who are in crisis with their loved one or supporting a loved one who is also in problematic drug use. So that's what I've been doing since, 2015 now. Yeah.
And Correne?
Approximately 15 years ago, my daughter started struggling with substances, and she's 36 now. So I've been doing this for about 15 years. And when I started, dealing with this, there was really no one to speak to. And then I heard Leslie on the radio one day and pulled over my car, because this was long before people would speak much about this crisis. And we met other people through this, and that's how I became involved.
So, Leslie, you started by saying, this is the reason I do what I do. Mm-hmm. So what do you do, and what does Mums Stop the Harm do?
As I say, Mums Stop the Harm as an organization does the two things: advocating for better drug policy and for supporting families with a loved one still with them, or people who have lost someone. However, what I do personally within that organization is I advocate. I'm an advocate. I'm on media as often as I'm asked, because I think that's the best and widest audience I could ever get to spread the awareness of drug harms, and also to educate the public about the possible solutions to this terrible situation we're in. So advocacy for me personally is the biggest part of this now. I was asked once by a reporter, she asked me, do you do this for your son? And I said, no, I do this for your son. We want to keep people alive.
What do you think right now, both of you, the big problem is? Like, from where we are right now, which is, I know very little about this, so I'm learning as much as anybody else. What is the biggest problem, and what are some of the solutions from where we're at right now?
That's a good question, and that's a very big question, right? One of the biggest problems is stigma. Stigma against people who use drugs, people who are addicted, people who have substance use disorder, as we call it. So the public has a great stigma around drug use. It's not the same as people who maybe my uncle has alcoholism, or, a family member has alcohol, or maybe someone smokes cigarettes. There's very much less stigma around those kinds of addictions, and they are addictions. But drug addiction has suffered stigma since the turn of the last century. It's hard to get policymakers to put in place policies that will support and help people who use drugs, because the public just wants them essentially to go away. And so we struggle with the policymakers, the politicians, to show and educate them on what's going to actually help the folks who are in addiction. There's a great resistance.
What are the big drugs that are out there that you're talking about?
Why don't you speak to this?
Sure. Right now, I mean, this crisis, the fentanyl crisis, started in 2016, which is when people started noticing people dying. And fentanyl is a synthetic drug that is not it can be made anywhere. And it's extremely strong. Fentanyl is used in the hospitals. It's a painkiller, but the toxic drug crisis is now synthetic. I think that started in 2016. Then COVID happened. Fentanyl took over from where heroin was. Heroin was a drug of choice for many people. Then it went on to fentanyl. Now we've got benzos in it, and it's just the toxicity, the unknown quantities of fentanyl that are in people's drugs.
So do people go out to buy fentanyl as a drug, or do people go out to buy other things and fentanyl is in it?
Both. People that are very addicted and have been using fentanyl for a long period of time continue to use fentanyl, as my daughter does.
Just fentanyl?
And she's used to it, so it's not going to kill her. But say perhaps somebody is going to a wedding or a party and they think, I want to go get some cocaine. And they do. And it's got 1 grain of fentanyl in it. They will die. And that is the problem. Fentanyl will kill anyone that touches it that's not predisposed.
And it's kind of my understanding, I heard this on the radio years ago coming from an expert, that was something like heroin or cocaine, and probably the other drugs as well, you can actually live a very normal life. Sure. You can work and carry on very, very well, except that you have to go into the underworld to get the drugs, and they're always tainted, and they damage your health, and you lose your job, and you sink down. But really, the drugs themselves are not necessarily dangerous to use. Is that close to correct?
I believe that.
Yeah.
Yes.
I would. Sorry. Go ahead.
So, no, if you're saying if you get it from a safe.
Yeah, like I could use heroin for 10 years and I would maybe be okay. Yeah.
Yes.
Yeah, and that's how it used to be actually when heroin was on the scene. Many people were addicted to heroin, but they led normal lives because they had it under control. They knew how to manage that. I was going to say, I was just going to make a slight correction, but I know what you meant. You can't just touch these drugs. And you hear this in the media sometimes. Oh, a cop busted a lab and he or she touched fentanyl and went into overdose. It's not true. You cannot just touch this drug and have it put you into an overdose situation. You'd have to be wallowing in it, or I don't know, can't even think. If you inhaled it, that's a different story. So I just want to, you did say touch, and I know what you meant. You meant if you,
yes,
using basically.
Correct.
My own feeling is I don't see being on drugs as a horrible thing to be. I mean, it happens. People get addicted, and I don't look negatively on people who are on drugs. But let's talk about. I think what you think is one of the big solutions is a safe supply. So if people could get a safe supply of the drugs they're taking, which seems to me, and I'm not saying I'm right, but it's always seemed to me is the way to go. Why not just give people the drugs they need so they're not going to get sick and die from tainted drugs? So I guess fentanyl is added to drugs because it's cheap and gives a big kick. Is that the reason?
Yeah, it's not even necessarily added to. It is the drug. I mean, there is buffers and other junk that goes into it. And as Correne was saying, benzodiazepines and other types of drugs like that are added to because they're cheap and available. Sorry, what was the question exactly?
Well, so for example, if you were going to buy cocaine or heroin, which I guess are major drugs that people are addicted to. Is that correct?
Yeah, there's not much heroin around.
Okay, so what are the big drugs that people are addicted to right now?
Well, fentanyl.
Just fentanyl?
Well, fentanyl's the main one.
Okay.
I mean, people...
What's second or third on the list?
Meth is very big.
Or cocaine, you mentioned.
And coke, but
Benzos.
benzodiazepines.
So is fentanyl sometimes added to these drugs just to make them stronger, and that's why people die from them, because there's too much fentanyl in the drug that they hope is safe?
That happens.
And it also is when the people, and as you know, you get your product and then it goes down the line, and each person is adding something to it to make it go further, the sellers. Right. So by the time it's getting to your basic street level seller, he or she's just trying to make their money to buy their own drugs, right? Yeah. So when they're adding things to it, perhaps whatever they're using to make their little bags or whatever has a grain of fentanyl. So if they're selling to someone that's not wanting the fentanyl, they will die when they smoke it. And the other part of that is people that are doing meth, again, if you're not doing fentanyl and it's in there, because you don't know what percentage of pure fentanyl you're using, 10% to 50%, that's a huge difference. And that's where all this is causing the deaths.
Okay. So then safe supply is the way to protect drug users.
That's right. That's exactly right. And that's what we stand for in a way. And this is what we advocate for most strongly. It's you know, if you go back to prohibition of alcohol back in the 1900s, and people and politicians in their infinite wisdom decided alcohol would not be legal, in which case gangs grew up. There was gang warfare. There was toxic supply of alcohol, which killed people. Then in their infinite wisdom, the politicians decided, okay, well, let's make it legal and regulated, because prohibition obviously didn't work. We are in the same, and so that's what they did. You know, you can go into every liquor store in the country and buy a safe drug, and that's alcohol. So we're still in the prohibition stage with drugs. So therefore, we have the black market. If we could, at the very least, have a safer prescribed alternative, a safer supply for people who are addicted, for people who have substance use disorder and absolutely need that drug today, so they won't have to go out on the street, we would see far fewer deaths. Mm-hmm. It also, the dynamic of having a prescribed and accessible, safer supply, in that scenario, you can hook people up with services.
Yeah, because they come in to get...
They come in, they need safety, they may need wound care, they may want to recover, go into detox, and then recovery. So there's everything about the safer supply is positive.
So what is the argument against safe supply?
Well, the argument that you hear from the politicians and the public that does not agree with it is they will say, we shouldn't be giving drugs to drug addicts and paying for them with taxpayer money. That is kind of the overriding thing that you hear. It is incorrect. It is... there's no empathy there, there's no compassion there, and it's full of stigma. So that's what the people said. They don't want to see people getting drugs from a prescribed place because they think that that's going to increase addiction and drug use, that we're allowing.
Not only addiction, allowing, but
promoting. Yeah.
Okay. Okay. Now I don't agree with that perspective, but I mean, I can see people do believe it.
Yes.
So what's the counter argument back that, people say, well, you're promoting drug. And I've heard people say, for example, I have to pay for my insulin. Mm-hmm. Why should somebody be getting free drugs? And, okay, that argument makes sense, even though, again, I don't agree with it. Is there a counter argument, or does it just go off into argument and it doesn't even matter anymore?
For me, I think the bottom line is education. People don't understand everything that goes into it. When people are using, substances that are toxic, the amount of overdoses, the amount of money that costs every time they go to the hospital, it is so there's so much money involved in this that if we went the other route that we're talking about, which they started doing, but it was shut down because of, again, political reasons. I mean,
You're talking
said,
about decriminalization.
and safer supply.
And safer supply.
Yeah, because it was nothing was done to a fulsome
level.
It wasn't done fulsome level. It was shut off. It was all these little pilot projects, and nothing's been done to a serious educated level, which is what needed to be done and needs to be done, because we're not alleviating this crisis at all. We're still losing thousands of people every year. That's a lot of people. If you look, 16,000 people in British Columbia since 2016, over 50,000 in Canada. That's an incredible amount of people.
And I guess in the States, you can multiply by 10, so that's 500,000.
Yeah.
Yeah, it's an emergency of the most dire type, and it's not being treated as an emergency. And again, we go back to stigma. Correct. The way people think about those folks who use drugs. It's stigma that holds all the reasonable, evidence-based ways to fix this problem. It just stalls. It stalls it. And if you don't mind, I would like to talk about decriminalization, because you brought up the word. One of the actual misconceptions about decriminalization is that decriminalization means that drugs are decriminalized. That is incorrect. That is 100% incorrect. What decriminalization was meant to do was to decriminalize the person who carries 2.5 grams or less of an illicit substance. So if I were wanting to buy some cocaine, say for the weekend, and I went to the street and I bought, 2.5 grams or less, then I could not be criminalized. It wouldn't be so much about the drug, it's illicit, and I couldn't be arrested. That's what decrim was. And that was to help reduce stigma, to help reduce the costs of incarcerating people, putting them into the criminal justice system for some small, 2.5 grams is a really tiny amount for people who use drugs. Mm-hmm. So it was designed to help move along the thinking around drug use. But unfortunately, it was weaponized. I was on committees to
when you say it was weaponized, you mean it was, as I saw it, when decriminalization came in, I thought, okay, it's not a big deal, but it's something in the right direction. Mm-hmm. And then it blew up into this, it either blew up or it was blowing up in the media into this huge disaster that was suddenly having nurses attacked in hospitals and other horrendous stories like that. It was all blamed on decriminalization. And right away, the government, of course, I don't blame them for stepping away from the idea because they were coming under attack but was that the truth? Was decriminalization okay?
No, it wasn't the truth. And in fact, I do blame the government, because if the person or people in power had actually correlated the numbers properly, they would have seen that decriminalization was almost a non-effect. All it did was keep certain people, if they were caught with these small amounts, out of jail. Yeah. It had nothing to do with addiction. It had nothing to do with decriminalizing drugs. It had nothing to do with people being in the ER or in the hospital acting out. That's
what I thought.
No correlation. What I blame the government for is to not educating the public. That's their responsibility, is to educate the public on the real story. Yes. And they did not do that.
Because of the election that came in last year, the provincial election, the other party had a shadow minister of health that just every day pounded on any of the safer supply, decrim, everything. And eventually it just blew up. And I know we were going to talk, perhaps this might be a good segue into safe consumption sites and OPSs. Sure. Because for an example, and that's to do with perhaps the doctors that are doing the ones here now in town or on the island to help save people's lives. And there was going to be some on the island. It was through the island health, and it was kicked back due to all this pressure.
So when you say some doctors here are doing something, what exactly are they
Yes,
doing?
they're doing pop-up overdose prevention sites outside of specific hospitals on the island.
And what is a pop-up overdose prevention site?
Well, it's a tent or a van or whatever you want it to be outside a hospital where people, when they're waiting in the emergency or mostly in emergency, it's somewhere they can go to use their substances without overdosing and dying in the bushes. And there's someone there to monitor them and help them if they overdose.
And I'll just add to that that it's their own drugs.
Yes, it's their
No
own
drugs
drugs.
are being given out, no matter what.
Right.
There's been some lies around that in the media too. No drugs are given out there. It's just you have medical people there in case, if it were me and I was in there and I had my own drugs and it was a bad hit, there's someone to revive me. There's someone to take care of me. It's a safety measure. It's so people won't die. Safe consumption sites and overdose prevention sites are the same in that way. They can also, on the positive side of things, again, hook people up with services, help them find maybe what they need to be healthy besides their addiction, besides their drug use.
You were both saying the government should do education. So here we are. What is the real story? I mean, let's say we had decriminalization and safe supply. And we want to have overdose prevention sites, right? So how can that be made to work without, I would think you need smaller ones, varied, and if there's bad behavior, it's cracked down on, so the neighborhoods don't even notice it. Just like there was concern about cannabis shops opening up, but who even knows where they are, right? They're just a little shop, same as the... So if you were going to educate the public, what are the facts and figures that you would put forward, and what is the hope that Mums Stop the Harm can see?
Well, one of the things I've asked for when I've been in government meetings is that the government create public service announcements that explain to the public the things we're talking about right here. It's very hard for people who don't know what's going on to be educated. People can always go to our website, mumstoptheharm.com, but the government's responsibility, I always go back to, we live in a democracy so far, and it's a good thing, and we expect our government to take care of us in some respects. So I have asked many times, and they've done it a few times, public health announcements, public service announcements that actually educate people on why we have the toxic drug market, why prohibition is still in our lives. Why are we still prohibiting these innocent individuals who happen to have an addiction, prohibiting them from what they need?
So if you were going to make one of these public service announcements, what would you tell people? You said why we have the toxic. What would, if you were the government making this ad, what would you say to people?
Just what I just said. I would say addiction, just like alcohol addiction or other gambling addictions, all these others, it's an addiction, and but it's also a public health concern, and people should be treated the way. If you go into the ER and you have respiratory ailment, you'll be treated with drugs, and you'll be treated and you'll be released, hopefully, and so on. If you come in with addiction to a toxic substance, you should be given a safer supply and other services. Most people who are addicted don't want to be addicted. Okay? And if they had the right treatment and the evidence-based treatment and accessible detox, most would go into it. You have to have some privilege to access that. I mean, the people on the street that we see who are visible, who are unhoused, they need And Correne can speak to this tremendous amount of help.
And they're only they're the visible part of the situation because they're on the streets. But you mentioned that in some industries that are physically demanding a lot.
The trades.
Trade.
Yeah, the
trades.
trades.
It's
Okay.
an enormous effect on the trades.
So that means a lot of tradespeople must be dying from...
Yes, absolutely they are.
I mean, even if that was said, people would say, well, wait a second, that's not the story I'm hearing, that it's just...
We've asked many times that this be, as it is a public health emergency, and I always go back to that it should be treated as COVID was, because it is a declared crisis. Let's educate. Let's have people talking, educating on the news, different things about this, where people can go for help, etc. I mean, that's one part that I find extremely frustrating after this period of time, the enormous wait times to receive help. If you want help, like we want it all, we want harm reduction, we want prescribed alternatives, we want access to treatment on demand. When someone needs help, it's a very short window. I always say that you want to get someone in. And that is the hardest part unless you want to pay the big money. And I'm talking $35,000 for 6 weeks is what you'll pay out of your own pocket. But you can get someone in immediately. So many parents have done that. It's incredible.
And does the treatment work for a lot of people? I'm sure not for all.
No, not for all.
Yeah.
I've heard so many different things. I ran a support group for families with loved ones struggling, and we have quite a few that their loved one is doing really well, and we have other ones that aren't. But I've heard it might be 5 or so times on average. There's an average that they need to go to treatment, but at least we need to have that option if someone's asking for help.
Do you feel the media has presented a fair picture of safe supply?
No.
And
Not at all.
No.
they're making it seem like a bad thing when really could be, from your perspective. And we have 1 minute left, so just enough time for a final comment from both of you.
Well, for one thing, safer supply, regulated pharmaceutical alternative, we call it. There is a statistic out there for every dollar that the government would put into harm reduction, which that is all these things we've talked about are about harm reduction, saves $12. Because you're looking at the EMTs, you're looking at the emergency room, you're looking at hospital beds, you're looking at deaths. All of these things cost, and the policing costs a tremendous amount of money. Yeah. So $1 into harm reduction saves $12 in costs of all those other things that come from the toxic drug supply.
Would you be willing to go on and discuss and debate on these kinds of programs you'd like the government to be doing and just put out? Would you be willing to discuss and debate with people with opposite points of view?
Oh, absolutely.
Absolutely.
Well, that's what we need.
We do it every day.
We need this kind of discussion. We need this kind of debate. And we need to come to, I think, what you're saying is the right answer. I can't guarantee that it is, but yeah, it's end the mess. Thank you very much, everybody, for watching this segment of Capital Region Watch.